Hello, I'm Dr. Gerald Lewis. Do we really need another medical website? If you go onto the net from your computer, your iPad, iPhone, you can receive medical information from hospitals and medical doctors such as WebMD, Mayo Clinic, Healthline and Medscape, and there are also specialised complementary therapy sites such as Dr. McCullough, Dr. Andrew Wheel, Dr. Whittaker, and many others. But unfortunately, each of these are experts and advise only in their own specialities. They tend to ignore or even criticise other therapies. Doctors don't consider that most complementary therapies have any action at all, and many complementary alternative practitioners believe that modern medicine often is poisoning the patients for a profit. Despite all of this, however, most patients tend to use both conventional and complementary therapies. Nearly all patients go to a doctor when they're sick and often get referred to a specialist. However, between 60 to 80% of people, particularly those with severe and chronic diseases, also look at complementary therapies as well. On the site, I want to discuss the best and the latest conventional and complementary therapies that are available and see how they can work together. In doing this, I'll allow the patient to choose on his or her therapies, and in addition, I put links and videos to help both patients and doctors to understand, because in many cases of complementary therapies, doctors don't know a great deal about them. So who am I? I'm a medical doctor living in New Zealand. I graduated from Otago Medical School, did a lot of my postgraduate training in the United Kingdom, and then worked for public and private hospitals in both countries, as well as running a private medical practice. I've always been a general physician, meaning I look after patients with all forms of diseases. And I think this is very important. We have far too many super specialists these days. I also trained in clinical pharmacology, which is the specialized use of drugs. I've also taken a very strong interest in cancer. I'm a cardiologist, and I've run a number of coronary care units and cardiac catheter laboratories, both in New Zealand and overseas. However, it hasn't taken me long to realize that my patients weren't always being helped by our modern medical treatments or operations, and that so-called alternative medicines were helping them as well, and at times better than what I was offering. So I decided to broaden my medical approach. I spent some years working at the Centre of Advanced Medicine using intravenous vitamin C to treat cancer and infections, chelation therapy, and other intravenous treatments. I also worked at primary heart care, where enhanced external counterpulsation helped my patients with angina, heart failure, and sometimes high blood pressure. I also studied many so-called complementary therapies such as acupuncture, mind-body medicine, nutritional medicine, homeopathy, and many others. This website brings together almost 50 years of this experience, and what I hope will be a useful site for people seeking what to do when they develop disease. My medical philosophy and the purpose of this site is to combine the best of conventional, complementary, and alternative therapies, and then let the patient and their health practitioner decide what to do, having realized their alternatives. Hopefully, with my judgment and experience, it'll be a great deal more reliable than Dr. Google, which many people use these days as their medical advice. I look at the site as a second opinion, allowing people to talk to their doctors and their specialists from the point of view of knowledge. On the website, down the right-hand side of the web page, is a list of diseases. Each of these has a description of the disease and what the doctors can do, including the most modern medical treatments. I update these regularly using the most recent medical journals, UpToDate, which is the site used by most hospital doctors around the world and other authorities. Then there is a section on what the patients can do with diet, exercise, and other complementary therapies which are available and might help. And I also discuss the thorny topic of nutritional supplements, which the medical profession tends to ignore and others believe is possibly the most powerful medicine we have. And I discuss which supplements I would recommend for each disease. The site is available free of charge to anybody anywhere in the world for 1 day. This enables patients and their relatives to search out information on their particular condition, and I'm happy for the pages to be printed and taken to the doctor if they wish. After 24 hours, people who wish to use the site on a regular basis will join as life members at a cost of $50. For this, they get unlimited use of the site, one free online consultation with Dr. Gerald, and a number of ebooks on cancer, supplements, and complementary therapies. We've also got an alternative program, affiliate program, where patients who refer others to the site are rewarded if they become life members. I'm hopeful that this site proves to be of value. I haven't found another on the web which brings together both conventional and complementary therapies to the benefit of the patient. And if there are any comments or suggestions or further diseases you would like included, I'm very happy to consider these. Contact me on my email address, geraldlewis@zoho.com.